Welcome everybody to GoLocal Live. I'm Josh Fenton, CEO and co-founder. Let's get a quick update this morning. There was word out of yesterday's, we reported on words out of yesterday's White House briefing about concerns about Rhode Island. We'll talk about that with Dr. Fine. At 1 o'clock today, Governor Raimondo's press briefing returns to the 1 o'clock hour. Again, she is still refusing, her administration is still refusing to allow reporters to directly ask her questions and for the public to hear it. There's no opportunity for public follow-up by the media. Very, very strange situation. Almost no other governors do it that way, except for I did see that Missouri has now banned the press from their own press briefings. Go figure, these governors. Dr. Fine, thanks again for joining us.
Good early afternoon. It's nice to be here.
Let's go to the numbers. You flagged that there's some concerns developing.
Well, just one-day numbers. And I don't put any store in one-day numbers, but you got to pay attention when you see jumps. So 527,000 people around the world have recovered. I always want to start with that. But 2.115 million people now test positive. The number of real positives is many times beyond that. But that's a one-day jump of 109,000 people, the biggest one-day jump we've ever seen. In the United States, we're up to 650,000 tested positives, a one-day jump of 45,000, probably the second largest one-day jump we've ever seen. 141,000 deaths around the world. That's a one-day jump of 12,000 deaths. And in the United States, 32,707 deaths, one-day jump of 6,000. Again, the largest we've ever seen. That may be just the way reporting congeals around the middle of the week. I can't tell. But if that continues, that's representative of considerable heartbreak around the world. Rhode Island is still apparently doing well by the numbers that I track. That is, we unfortunately had 7 deaths. That's about what we've been seeing. 3,529 positive tested cases, an extra 278 cases, probably a little lower because one-day testing on Monday didn't really happen. 229 people in the hospital, up a little bit. And 54 people in the intensive care unit, 44 on ventilators, also up a little bit. But I don't see a big change in the Rhode Island trends based on the numbers that we're looking at the moment.
Let's go to the White House in a minute. One issue that is definitely developing around the country, but it's certainly being highlighted in New York. Mayor De Blasio said, listen, you know, it's a big city. On the average day, 25 people die at home. During this period of time, it's 200 people are dying per day at home during the coronavirus crisis. He says that point of difference, that 25 to 200, those folks are dying in one way or another as a result of this crisis. Your thoughts?
I think that's probably right. I don't know if you saw, but New York City adjusted up its estimated number of deaths based on excess deaths. My old friend, who's the health commissioner in New York, made that distinction, and it was a wise one. We're seeing it in Central Falls. We're seeing more deaths at home. Haven't seen it in Pawtucket yet, thank goodness, but you know, this is a real thing, particularly for populations, for people that are more socially isolated, that don't feel like they have connections to family or connections to healthcare. People who are undocumented don't want to ask for help or identify themselves, and they're the people who are dying at home.
The other factor that was identified was people that are having heart issues or other complexities of pre-existing medical issues, is that they don't want to go to a hospital and then expose themselves to the coronavirus. Is that where we need some kind of bifurcated healthcare structure during this period in which I know if I've got a healthcare problem, I'm not going to go to that emergency room germ factory. I'm going to go over here to that new setup that's going to help me deal with my health problem?
It may be something to look at. We In the first couple of weeks of the outbreak of the pandemic, we noticed a substantial drop-off in people presenting with heart-related problems and with strokes, 40 to 50% difference. And that was hard to explain. At least part of the explanation may be that people are afraid. I suspect part of the explanation is we were probably overusing emergency room for those kinds of things before this. It'll take some time to tease it all out.
Okay, so yesterday at the White House task force press briefing in the Rose Garden, Admiral Birx says, listen, Rhode Island, we're very worried about Rhode Island. We've got concerns about Rhode Island. It's caught between two hot spots. She was inferring that they're seeing data or anticipating something taking place. It was, 4 or 5 sentences she made, but she hasn't made that kind of statement specifically about Rhode Island other than being in a high density, high impact area. Reading between the lines, what's your thought on the ambassador's comments?
Well, I don't want to second guess, but if I was going to be sitting where she's sitting, I'd be worried about our population density. That we have areas of very high population density, much like New York and much like parts of Boston. We have the traffic from state to state, and those things together may make us look like an accident waiting to happen. We have lots of people still going out to work and still spreading disease at work, still picking up disease at work. I think it's population density. This goes back to the beginnings of public health, where Rudolf Virchow in 1848 observed that it wasn't the typhus organism that was killing people so much as it was the way they were densely packed together. And it's those densely packed communities that I think we ought to be really focusing most of our attention on and really working hard on, as well as our nursing homes. Clearly now, I think we have 66 of 87 deaths have been nursing home deaths. We are also a very old population, and that puts us at risk demographically for our population of people over 85. You really look at the deaths, they've been really centered in the older population and the nursing home population. That plus our densely populated communities perhaps makes us appear to be an accident waiting to happen. On the other hand, we've done really well so far. Our rate of growth has been well contained. So I think we've got to play it day by day, but be ready for a huge surge, some of which we're starting to see in Central Falls and Pawtucket in terms of the number of people who are ill.
Should we be unpacking these nursing homes? I mean, this is a little confusing. The first cases in the country and the first deaths were almost all related to the incidents in the state of Washington, in which one nursing home was just absolutely decimated by the coronavirus. Why aren't we de facto pulling them apart and placing nursing home residents, at least for a period of time, in a facility like the convention center? I know there will be incidents because of transportation, but the amount of risk that's now going on in these facilities and the spread of them and the number of nursing homes that are now impacted, we can only foresee that there's going to be more trouble down the line.
Well, I think you have to try to balance the risks. There are risks of moving people. There are risks for the emotional devastation that happens when an older person is moved out of surroundings that they're comfortable with. Many of the small nursing homes are run by families who really have their heart and soul involved with caring for people and do a pretty darn good job. And when you get into a larger congregate setting, it's harder to get that kind of personalized care. On the other hand, if we see staffing problems progressively, and if we can't staff the small nursing homes, we may be forced to do that. My sense is that my old colleagues at the Department of Health are being very thoughtful and cautious, and trying to keep things operating in place as best they can, as long as they can. And at the moment, that seems like a good decision. But if this disease gets into more nursing homes, I think it's going to be harder and harder to sustain that approach.
Massachusetts is seeing a surge, very significant, triple numbers of deaths now daily, massive numbers of new cases. The governor admits they're in the surge. They have put, I believe it's thousands of people out on the streets to try and address some of the issues of density, education, outreach, to be able to make sure that those citizens are getting directed to the right health care at the right time. Does Rhode Island need to take on that strategy now?
I would love to see that strategy. It's something I work on every day when I'm not talking to you, is to try to figure out how we do that in Central Falls and Pawtucket. And my sense is that we need more resources. We don't have the ability in any part of the state to know who everyone is and check on everyone every day. And boy, I'd like to see us doing that, because I get worried about the people who are too afraid to ask for help, who are sick in their homes, and don't know what to do or who to call. I think there's lots of running the process of communication. Unfortunately, just having a conversation on GoLocal or putting things on television doesn't get to every single person in the state. And we have to personalize that, understand that we have to do some things with language that we're not doing, that we're trying hard. But we have to have, I think we have to get to contacting every single household, reaching out again and again, and keeping our ears to the ground as we, and you've heard me say this before, try to get every single person who's got symptomatic disease in a densely packed living environment out of that environment, and into isolation so that they can recover without spreading disease.
The last couple days' narrative at a number of levels has really, I think, changed Americans' perception of how long this is going to take. We talked about yesterday Governor Newsom from California announcing that this summer there's not going to be any sporting events in that state in all likelihood. We talked a little bit about BU probably pushing off classes, in-classroom classes till the winter semester. More narrative coming out that a herd mentality, herd approach to combating this is, herd immunity, that strategy is 18 months, 12 to 18 months away. Hard to judge because there's not enough testing, and that a vaccine is 18 months away. Do you foresee, and I know it's early crystal ball, but do you foresee that we're looking at some form of where we are right now for 9 to 12 months?
Well, I'm trying not to do any foreseeing till I get data, and the data isn't good enough to do any real foreseeing. I think if I had to make a guess based on where we are now, I think I'd probably come down on 6 to 9 months like this, or close to like this. If we get sophisticated, we may be able to open up in some places and stay closed in other places. But I think we're going to be living with this. I think we are going to be living with this for a while, 18 months, 20 months, I don't know. I think masking is in our immediate future. But I'm really hoping that we'll see herd immunity emerging in ways that we don't have any evidence of. That's, if we get that could change the calculus entirely. And that's that's my unrealistic and unreasonable hope, that we see that emerge.
Dr. Fine, what else do folks need to know today?
Keep doing what we're doing. Work on making sure that anybody who's sick stays in isolation. Work to make sure that people in isolation at homes really stay isolated from other family members, follow the rules, and ask for help if you need it. You gotta ask for help if you need it. This disease can turn dangerous in a second. And if people are short of breath, if you can't take in fluids, or if you have persistent very high fevers, please, please, please call somebody, ask for help, and let's get to a place where we can provide you the support you need until you recover.
Dr. Michael Fine, as always, thank you so much. Appreciate you taking the time. For everyone else, the governor will be back at 1 o'clock again. She is not taking questions that the public can hear from the media. That policy continues on and on. She has said, after previously stating she'd release modeling, that today she will be disclosing some elements of the state's modeling structure. So we'll stay tuned for that. Thanks, everybody, for tuning in. See us back at 1 o'clock for the governor's press briefing. Thank you.
Thanks, Josh.